Friends, good evening. This is Dr. Manjunath, your FMT Guru, your Forensic Medicine faculty. We are going to discuss today Forensic Practicals 3. In this session, we are talking about medical examination of victim of rape, basically the practical aspects, the medical examination of accused of rape. As you know, both are very important theory questions as well. In this session, we are talking about how to write the certificate, especially in examination of victim of rape and accused of rape, some related MCQs and the facts. Yes guys, I'm audible and visible. Audio, video, is it clear? Rakesh, good evening. So good evening guys. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Good evening. Rakesh, Rohit, Meena. So in yesterday class, we discussed about skeletal remains and briefly about MCCD, medical certificate of cause of death. In first session, we discussed in detail about injury certificate and age estimation certificate. Yes, all good, all well. So let's start. In the beginning, I have a question for you. In Indian scenario, only a man can be charged for raping a woman. Female cannot rape a man. Is it true or false as per BNS? Can anyone comment on this statement? Is it true or false as per Bharatiya Nyaya Samhita? 63 BNS, 64 BNS. Is it true or is it false? Come on guys. Sanskar Agrawal. Just write true or false. See, the definition of rape is given by 63 BNS. The punishment is mentioned in 64 BNS. As per 63 BNS, only the male is the offender. Okay, so it is true. So try to memorize 63 BNS definition of rape. A man said to commit rape, a man, not any person. So it is true statement. 64 BNS, try to memorize. Punishment, imprisonment, life imprisonment, rigorous imprisonment, simple imprisonment, death sentence mentioned in 64 BNS. 64(2), that is basically custodial rape. So these two are very important viva question. 63 definition, 64 punishment. Okay, that's okay. Good, thank you. Jai Krishna, Miras, good. Many are telling true, true, true. That's great. Yogesh telling true. Fine. Then one more question. One more theoretical question. Just to explain you. Descriptions of rape. Sexual intercourse with a wife, BV, below 18 years is rape irrespective of consent. What do you think? Is it true or false? Minor wife, less than 18 years. Anyway, the marriage is invalid. Marriage itself punishable offense. Is it rape or not a rape? What do you think? As per 63 BNS, as per 7 descriptions of rape, it is true statement. and case must be filed within 1 year. Within 1 year of sexual intercourse, as per Honorable Supreme Court judgment. It is again true. Srimati Shukumar. Good. With this introduction, let's start medico-legal report on alleged victim, survivor of sexual assault. The better word is survivor of sexual assault, not the victim of rape. The survivor is the better word as per the recent textbook. Medico-legal report usually that is mentioned in 184 BNSS. So try to memorize survivor. If you write survivor is equal to 184 BNSS. BNSS matlab Bharatiya Nagarika Suraksha Samhita. The same accused of rape. Accused 52 BNSS. Please write in the chat box. (184) 52. Write in chat box. Keep writing. Rakesh, Samskar Agrawal, and others. Now, what are the components in the beginning? The first component, general particulars, like the name, address, age, everything that is in general particulars. Then the very important component is informed consent. Informed consent is mandatory. You cannot force the victim for the examination without consent. It's a punishable offense. It amounts to assault. Or else, in some cases, you can document informed refusal. As we discussed in theory classes, informed means you need to explain everything. The procedure, the advantages, the benefits, or risk of the procedure. Okay? Informed consent. The consenting age is 12 years. So, viva question can be asked. What is the consenting age? Informed consent 12 years. The consenting age for sexual intercourse is 18 years. Less than 18 years, I said statutory rape. Okay? Okay, good. Vera Sopova, that's great. Identification mark, at least 2 identification mark. Mole, birthmark, scar mark, permanent tattoo, anything, 2 identification mark. Presenting complaints can be bleeding, pain, okay, anything that is related to the case. Presenting complaints. History, the history of the sexual violence, an examination, gender physical examination, systemic examination, and the local examination with the consent by female doctor. Okay. Investigation and treatment, just to rule out HIV, hepatitis B, or some sexually transmitted disease, to rule out pregnancy as well. Collection, preservation of sample, this is a 3 marks question. What are the samples to be collected in case of examination of survivor of rape? Then comes his provisional opinion. Once you receive all the reports from the laboratory, from the forensics in laboratory, histopathology and all, you can give a final opinion about the sexual violence, forceful sexual intercourse, or intercourse with the help of date rape drugs. So there are 10 points are there related to the medico-legal report. So we are going to discuss in detail about every point. General particulars. So general particulars, name of the hospital, like example, MAMC New Delhi. MAMC New Delhi or LNJP Hospital, New Delhi. OPD number, hypothetical OPD number you can mention. IP number, name XYZ, daughter of, son of. So POXO cases, remember POXO. POXO, the victim can be male also. Okay, that's why it is mentioned son. Address, age, the age is very important. If age less than 18 years, it attracts POXO. Age more than 12 years, he or she can give valid consent for the medico legal examination. Date of birth, rule out POXO. As you know, most of the offences as per POXO, they are non-bailable. Okay, like section 4 of POXO Act, penetrative sexual assault, PSA. Sex, male, female, others, third gender, that's a legal gender. Date and time of arrival in hospital, can mention about that. Date and time of commencement of examination, so don't do any delay. Don't delay the examination. You need to start the examination immediately. Then brought by police or brought by relative. MLC number. MLC is mandatory. You must give information to the police as per the law, as per the section of POXO. Otherwise, it can be a punishable offence under various section 1921 of POXO. Police station, ITO police station, New Delhi, or New Delhi police station. Whether conscious, oriented, time, place and person. This is very important. To give valid consent. The consent becomes valid when the patient or victim is conscious, oriented to time, place and person. You can ask simple question, what is your name? What is your father name? 2 + 2 is equal to 4. Like that you can ask simple question. You can confirm the orientation, consciousness as well. If disoriented, then the consent become invalid, the statement become invalid, even dying declaration also. Any physical, intellectual, psychological disability, if anything, that you can mention. So this is about the general particulars. Now the point here is the disclosure of the particulars, general particulars to media, to any person without consent or without permission from the court is a punishable offence. Disclosure of identity, revealing of identity is a punishable offence as per 72 BNS. So all of you write 72 BNS is disclosure of, disclosure, just write disclosure. Never disclose, man, never disclose. It's a heinous crime, it's a serious crime. Disclosure can be punishable offence. 72 BNS. Please write in the chat box. 72 BNS, 2 years of imprisonment. The punishment is revealing identity of victim to the media or any person without the consent of the court, permission from the court. Write this, 72 BNS, disclosure. Srimati Shukumar, बहुत बढ़िया. Superb, are you there? Rakesh, any doubt in this? Any doubt in general particulars? याद रखना पड़ेगा. 18 years consenting age for sexual intercourse. 12 years consenting age for medical legal examination. Less than 12 years, you need to take consent from the custodian. Okay? Loco parentis, father, mother, like that. Hostel warden, like that. Okay? So male, female, others, transgender, I said, so legal gender. And less than 18 year, remember, POCSO, protection of children from sexual offences. Is it okay? All 11 points. Clear? Bhumika, Srimati. The next is basically, this is the examination room. This is how we examine. Examination of survivor of sexual assault, a victim of rape, with the consent. याद रखना पड़ेगा, with the consent. Now consent. How to mention the lines of consent? What are the valid lines? Remember, consent must be taken in patient's own language, in presence of witness. Very, very important. Examining patient without consent amounts to assault. Okay? Now, so this is the standard consent lines from the standard textbook. Viva question. बार पूछते exam में, you just tell me about the lines of consent. I, daughter of, wife of, hereby gives my consent. Consent मतलब permission है. Medical examination treatment, yes or no? Medico-legal examination, yes or no? Sample collection, clinical forensic examination. I also understand that as per law, hospital is required to inform police. This has been explained to me. I want the information to be revealed to the police. So you can see here police, not the media, not the newspaper. Yes or no? The next line. I have understood the purpose of examination, procedure of the examination, including risk and benefit, explained to me by the examining doctor, by female doctor. My right to refuse examination at any stage, the consequence of such refusal, including that my medical treatment, will not be affected by refusal. Okay? Has also been explained to me, may be recorded. Contents of the above have been explained to me in dashed language, Kannada language, Hindi language, Tamil language, any language, the patient's own language, as per the rule of consent. With the help of social educator, yes, sometime, interpreter, support person, a special educator, interpreter, then you can take the name and signature of the survivor, parent, guardian. So if less than 12 years, you can see here less than 12 years. Name and signature, thumb impression of the witness with a date and time and place. Left thumb impression. So this is 3 marks question in your exam. So this is the standard consent lines as per the standard textbook. I hope you understood. Any Rakesh, Veda Superb, any doubt in this? Any doubt in this consent line? Come on guys, are you there? Are you there? This completes your second part. The first part is general particulars. 72 BNS. Second part is informed consent. 12 years. 12 years. 12. Come on guys. Yes or no? Are you there? Are you there guys? Bhumika, Srimati, Shukmar, you need to interact with me in all the classes. So you can keep yourself awake. You can keep me awake in the class. Okay? Not easy. Bhumika, Srimati, clear, both badhiya. Excellent. Then comes his identification marks. I said 2 identification marks. 1 and 2. Okay? This is easy. Done. Presenting complaints. What are presenting complaints? So, pain. Okay? Generalized body pain. Pain while walking. Abnormal gait. Bleeding from vagina. anus, mouth. All these are usual presenting complaints. Again, depends on the case. Then comes his history, brief history about the sexual violence, date and time, location of the incident. Okay. Every evidence matters in this case. Every evidence. Number of assailants. Gang rape. Gang rape means more than one person. Okay. Name, sex, appropriate age, any relationship with the survivor. So try to memorize gang rape punishable under 70 BNS. So please write in the chat box. Gang rape. Gang means more than one. 70 BNS. 70G. 66 rape and murder. 67 sexual intercourse by husband with the wife during separation. 68, that is having sexual intercourse in custody with consent. 69 false promise of marriage. 70 gang rape. 71 repeat offenders. Okay, so just remember gang rape, 70 BNS. Keep writing guys. Srimati Shukuma, Bhumika with Super Rakesh. ठीक है, आगे देखते हैं. Description of incident in words. Okay. Type of physical violence. So physical violence. So there can be blunt force injuries, sharp force injuries, like example cuts, incised wound, sometimes stab wound, sometimes abrasion, bruise, laceration. The laceration involving intestine, genital region, because of the physical violence. Sexual violence, genital violence, genital injuries, physical violence. So when injuries are there in the body, it shows physical violence. That means forceful sexual intercourse. Okay. Emotional abuse, if anything. Drug and alcohol intoxication by using date rape drugs. Like example, GHB. Gamma hydroxybutyrate, or sometime rohyphenol. So GHB, rohyphenol, they are date rape drugs. So they usually cause antegrade amnesia. They start their action within 15 minutes, persist for about 1 to 2 hours. You must have seen many movies like Euphoria and all. Euphoria, whenever you're free, just go through that movie. Just watch that movie, Euphoria. So something related to the sexual offenses, especially forensic medicine. Euphoria. Yes, Rakesh, have you seen Euphoria movie? Euphoria. Telugu movie. It's a Telugu movie. Again, it's dubbed in all the languages. A world now. So, I've seen Rakesh, Weather Supava, Bhumika, Srimati Shivkumar. So, in that movie, everything is mentioned. POCSO Act, the examination of victim of POCSO or rape, then courtroom evidence, the cross-examination, re-examination, then what is the punishment, what happens to accused. And all these are shown very dramatically in the movie. Very nice. Have you seen that movie, Rakesh, Bhumika? Euphoria. Euphoria. No. Jahir Ahmad. Hello. Hello, Jahir Ahmad. How are you? If survivor has left any marks of injury and assault, especially bite mark, very important evidence. Bite mark casting, the important component of forensic odontology. Okay. Yes. So this is about the history. Chalo, bahut badhiya. Okay. Then comes his details regarding sexual violence. Details, yes or no, Don't know against each item. Penetration by penis, finger, object, any other body part, vagina, urethra, anus and mouth. So any of these can be rape. Rape definition given by 63 BNS. As per 63 BNS, any of PMA. P means penetration, I for insertion, M for manipulation, A for application. Okay? Penetration can be rape. Point number 1. Insertion can be rape. Insertion of any object. Manipulation. Manipulation of the body. I for application of the mouth. PMA. Then ejaculation. Presence of motile spermatozoa that shows sexual intercourse in last 6 to 12 hours. Oral sex, also known as sin of Gomorrah. Post masturbation, that is known as exhibitionism, that is punishable under various sections of BNS. Okay. Then all the events, post incidents events, as survivor change clothes, undergarments, clean clothes, undergarments, but then time since incidents, any vaginal, anal, oral bleeding, discharge, any painful urination, abdominal pain, everything. So you can mention all the details about the sexual violence indication. Okay. Then comes is safe kit. The question can be asked, what is safe kit? Safe kit is sexual assault forensic medicine forensic examination kit. It's also known as SAEC kit also. Evidence collection kit. So safe kit or SAEC kit. SAEC kit. So please write in the chat box. Safe sexual assault forensic examination kit. SAEC sexual assault evidence collection kit is also known as Vitalo kit, basically for trace evidence. Trace evidence. Please write Rakesh Bhumika, Jahir Ahmed, Srimati Shukumar, Veda Supama. Please write safe kit or SAEC kit, both are same. It includes basically all paper bags. Okay. Point number 1, paper bags, not the plastic bags. Swabs, distilled water, containers, everything related to trace evidence. There are 14 steps are there. 14 steps as per the standard textbook. Oral swab, anal swab, vaginal swab, swab from the breast, swab from the inner side of the thigh. Okay, like that. So every evidence matters a lot. Every trace evidence, everything is important as per the law to prove the crime. Okay. Yes, safe kit, SAEC kit. आगे देखते हैं examination. In examination, the first thing, general physical examination. In that you can mention pulse rate, blood pressure, temperature, respiratory rate, pupils. Okay, any observation in terms of general physical well-being of the survivor, abnormal gait, injuries on the body, like example abrasions, bruise, laceration, can be incised wound, stab wound, anything. Local examination. The very important evidence is Hymen tear. Hymen tear is, again, question asked in exam. What is the common site of Hymen tear? Anyone? What is the most common site of Hymen tear in a case of virgin? Anyone? Example, this is the hymen, this is the 12 o'clock position, this is the 6 o'clock position. What is the most common site of hymen tear? Hymen tear is very uncommon in children because it is deep seated. Hymen tear is anterior in case of insertion. Hymen tear is posterolateral in case of penetration. So this is the common site, posterolateral. The instrument used is GK rod, Gleister Keen rod. The substance or the solution used is toluidine blue. So toluidine blue basically to identify micro injuries. If micro injuries are there over the vulva, labia majora, labia minora, vagina and all, so this toluidine blue goes and binds with the exposed DNA RNA. You will see the blue color stained area. The blue stained area that shows micro injuries. So toluidine blue, GK rod, posterolateral, everything is viva question. 6 o'clock position, posterolateral, that's great. That's great answer. Then comes is extragenital examination. All this, okay. Then per vagina, per speculum examination. Should not be done unless required for detection of injury or medical treatment. Okay. Then anus, rectum, oral cavity, then systemic examination. So this is a very important component of certificate examination part. You can see here there are 4: gender physical examination, examination of injuries on the body, local examination of genital parts, then the systemic examination. So there are 4 components in that. Yes, is it clear? Srimati Shivkumar, Bhumika, Rakesh. I'll just repeat. Most common site of hymen tear is posterolateral between 6 to 7 o'clock position or 5 to 7 o'clock position. In case of insertion, it is anterior. In case of children, hymen tear is very uncommon because it is deep seated. GK rod is used to document a hymen tear. Toluidine blue is used to identify micro injuries. Again, question can be asked: difference between true virgin and false virgin. What are the signs of virginity and all? Sometime in some exam. Okay, is it clear? Yes, guys. Are you there? आगे देखते हैं. Now look at this. All these are defensive injuries. Defensive injuries. Defensive injury can be active defense injury, passive defense injury. Can anyone identify what is this defensive injury? Is it active or passive? Is it active or passive? Active, active or passive? Anyone? Anyone? Come on, guys. Passive. Good answer. Good, good, very good. It's a passive defense injury. Good. Now look at this. What is this injury? It's an AI image. AI image. Okay. This is again road surface injury, lip bruising, fingertip bruising, and all. Okay. Yes. Investigations. What are investigation? Blood for HIV, VDRL, hepatitis B, urine test for pregnancy. Okay. It's an indication for MTP. So pregnancy as a result of rape is a valid legal indication for MTP, medical termination of pregnancy. Okay. Ultrasound for pregnancy and internal injury, X-ray for injury and fractures. Okay, and treatment options are STI prevention treatment, especially HIV, hepatitis B, emergency contraception to prevent pregnancy, wound management, tetanus prophylaxis, hepatitis B vaccination, post-exposure prophylaxis for HIV and counseling, and others. So counseling basically is psychiatric counseling. Rape is a heinous crime. It leads to many psychiatric complications in victim. So post-traumatic stress disorder. So for that, psychiatric counseling is very important. Okay, rape trauma syndrome we call it as. Then comes his collection, preservation of samples, very important. Clothing, very, very important evidence. Clothing, including the inner clothing in paper bags, not the plastic bag. Physical evidence collected on white sheet, like example, any loose hair, any foreign body. Okay. Hair, basically head hair combing, scalp hair, pubic hair combing, matted hair, then nail clippings, nail scrapings, basically for DNA, swab from the breast, mouth, inner aspect of the thigh, vulva, vagina, cervix, anus, urethra, smears and slides, air dried, vaginal washing, blood grouping to rule out any drug intoxication like alcohol, and DNA analysis. Then urine drug testing, urine for drug testing. So this is important, 3 marks question. The very important component of examination of survivor of rape as per 184 BNSS. Yes, okay. आगे देखते हैं provisional opinion. You can give provisional opinion. I have examined name of survivor, male, female, other, aged, reporting time. So in reporting time, you can mention dash days after the incident, dash hours after the incidents. My findings are as follows. Samples collected for FSL checklist, sample collected for hospital laboratory, clinical findings and additional observation. The opinion is kept pending awaiting the above laboratory reports, date and time of completion of examination. This report contains dash number of sheets, dash number of envelopes, signature, name of the examining doctor, seal of the examining doctor, place. Provisional opinion. Then once you receive all the reports, then you can give final opinion. The final opinion can mention like this, same lines, finding in support of above opinion, taking into account of history, clinical examination, laboratory reports, bearing identification marks described above, dash hours, dash days after the incident. I am of the opinion that, okay, opinion again depends on the injuries, depends on the physical injuries, genital injuries, yeah, local examination findings, laboratory findings, so it depends again. Now look at this. In general, final opinion to be formulated after receival of report from the FSL, 5 probable opinion. The first opinion, there are signs suggestive of forceful vaginal anal intercourse. Forceful vaginal anal intercourse when physical injuries are present. FSL report shows injuries. Positive for presence of semen. So this is the opinion number 1. If genital injuries are there, physical injuries are absent, positive for presence of semen, then you can write there are signs of suggestive of forceful vaginal anal intercourse because genital injuries are there. So any injury, genital injury or physical injury, then the report is almost same. Forceful vaginal intercourse, anal intercourse. If genital injuries are absent, physical injuries are there, still there are signs of suggestive of forceful vaginal anal intercourse. Opinion number 3. Genital injuries are absent, physical injuries are absent, positive for the presence of semen, that shows there are signs suggestive of vaginal anal intercourse, but here the word forceful word is not there. Absent, positive for drugs, you can mention there are signs suggestive of vaginal anal intercourse under the influence of drugs or alcohol. So this is how the opinion is formulated in case of examination of victim of rape. Now, can anyone tell me the report? Now I'll give you some findings you need to formulate. Abrasion present, bruise present. Point number 1. Hymen tear is there, hymen tear present, bleeding present. Okay. Then positive for semen, semen is also positive. My question, what is the opinion among this? 1, 2, 3, 4 and 5. So the findings are abrasion, bruises are there over the victim, hymen tear is there, bleeding is there, genital injuries are there, the semen spermatozoa is also positive. In simple word, what is the opinion among this? It's 1, 2, 3, 4, 5. Just mention the name, mention the word. Is it opinion number 1, 2, 3, 4 or 5? Anyway, 1, 2, 3 are same only. Only 4 and 5 are different. Keep answering, guys. Keep answering. Bit difficult one. Srimati Shukumar is telling. So Bhumika is telling 1. Bahut badhiya. So Srimati Shukumar, Bhumika is telling, sir, there are signs suggestive of forceful vaginal intercourse. Okay. Is it clear? Opinion, guys? Any doubt in this? This part is difficult. This is simplified. Again, for penile penetration, this is how we formulate. And for non-penile penetration, it is different. Non-penetrative assault also it is different. So for UG level, this is more than sufficient. Veda Supava, Bhumika, Srimati Shukumar, Rakesh. Any doubt in this? Any doubt in this? Okay. So this is the standard medico-legal report and its components. No. Okay. Hello. Now I have some MCQs. You need to answer this question. A 35-year-old man forcibly takes his neighbor into his house, sexually assault her As a result of these injuries, victim falls into persistent vegetative state, unable to communicate or perform basic functions independently. It is punishable under. So here rape and BBS or murder or some brain injury. ठीक है? So option 66, 67, 68, 69. 69 false promise of marriage. 68 authority by person in authority by boss. 67 husband. 66 is the correct answer. 66. Okay, this is the question. I think nobody has answered. It's okay. Now, Y and X have been married for 5 years, but due to ongoing marital issue between husband and wife, so some domestic violence issue, so dowry issue, or compatibility issues, they decided to live separately. So husband and wife, they are living separately. Husband separate life, wife separate life. X moved to her parents' house. They are in process of getting legal separation. On one evening, Y visits, Y means husband, visits X parents, forces himself on her without her consent. So consent is not there. With consent, okay, no problem. Without her consent, it is punishable under same option. 67 है, 66 है, 68 है, 69 है. So husband wife during separation without consent, is it punishable? Definitely punishable. Under the what section? Under the section anyone. Srimati Shukumar Vinod Upadhyay, very good. It is 67. याद रखना पड़ेगा. 67. 7 means husband. Husband, how many alphabets are there? 1, 2, 3, 4, 5, 6. 67 husband. So write this, husband. 67 husband. ओके, आगे देखते हैं नेक्स्ट क्वेश्चन. रिपीट ऑफेंडर. So he is a serial offender of rape. Okay, punishable under repeat rape. Repeat offender, whenever word repeat offender, it is 71 BNS, 70 gang rape, 72 identity, 66 rape and murder. Okay, हो गया? Is this okay? Good. 71. आगे देखते हैं. Sexual intercourse by using abuse of power, punishable under abuse of power. Like example, boss having sexual intercourse with the consent. The consent is there. याद रखना पड़ेगा. In this, abuse of power is there. So a doctor having sexual intercourse with someone by using his abuse of power, consent is there. A boss having sexual intercourse with the employee with her consent, with the promise of something, then is it punishable, not punishable? Remember, it is not rape. It is not rape, but it is punishable. ये punishable है. ठीक है, याद रखना पड़ेगा. What is this? So this is basically 68 BNS. 68. 8 is there, no? 8. Authority. That is 68 BNS. हो गया? 68. श्रीमती शिव कुमार, बहुत बढ़िया. आगे देखते हैं. Sexual intercourse by using false promise of marriage. False promise. Shadi. So male is there and female more than 18 याद रखना पड़ेगा. False promise है. वादा, झूठा वादा. 70, 71, 72, 69 याद रखना पड़ेगा. 69 is promise. I hope you understood all the 5 important MCQs. Okay, आगे देखते हैं. Now report on medico legal examination of accused. Now in detail we discussed about the victim of rape. Now the accused of rape. Accused. I have a question for you. What about the consent in accused of rape? Is it mandatory? Is it must? Or consent is not needed? What do you think? What about the consent during examination of accused of rape? Can you examine the patient or can you examine the accused without consent, with a reasonable force? Say yes or no. Consent needed, but not mandatory as per the law, as per the 52 BNSS. What do you think? Come on, guys. Srimati Shivkumar, Bhumika, Vinod Upadhyay, Veda Suparva, are you there? Come on, answering. Keep answering. Come on, guys. Answer this question. Your energy must be very high in forensic class. So, okay. Srimati Shivkumar is telling, sir, not needed when police brought the accused. Excellent answer. Bahut badhiya answer. Srimati Shivkumar. Sir, not needed, not mandatory. You can examine even without consent, even with a reasonable force. That is mentioned in standard textbook as well as the law 52 BNSS. Okay, this is very important point. चलो ठीक है. Not mandatory. बहुत बढ़िया. 52 BNSS. What are the components briefly? Okay, not in detail. General particulars. So all general particulars. Consent. Yes, consent. Identification marks. Relevant medical surgical history. History related to sexual violence. All these are components of examination of accused. GP, general physical examination. Examination of injuries on the body. So injuries on the body matches with the history given by the victim. Definitely very good evidence. The bite mark over the accused. Bite mark casting. It's a very important trace evidence, very important evidence, physical evidence. Like example, bite mark. Bite mark is a type of patterned abrasion, patterned bruise. Then local examination, sample collection for clinical laboratory, collection preservation of samples for FSL, hospital laboratory FSL reports, a final opinion, then signature, designation of doctor. So there are 13 components are there during examination of accused of rape. Okay. Again, the final opinion, how to give opinion in case of accused of rape. This is also very important. Findings in support of above opinion, that taking into account the history, clinical examination finding, laboratory reports, bearing identification marks described above. Okay, again there are 4 opinions, A, B, C and D. What is A? The A, there are signs or no signs suggestive of recent sexual intercourse. Okay, there are signs, no signs suggestive of being under the influence of drug or alcohol. If alcohol is there, drug is there, can go against him. Anyway, there are no signs suggestive of sexual intercourse or any other comments. So in general now, in general, impotency is not a defense, not a defense as per new definition. Okay, 63 BNS is mentioned. Not only penetration, even insertion of fingers, application of mouth, manipulation of body can be rape. So defense, impotency can't be a very good defense in court of law. Okay. Sometimes question can be asked, how to give impotency certificate, double negative form. It is given in the form of double negative impotence certificate. The person is incapable of performing sexual intercourse. If some injury is there, Peyronie's disease is there, or some castration is there, or cutting a penis, no penis, then incapable of performing sexual intercourse. Or you can give opinion, there is nothing to suggest that the person is incapable of performing sexual intercourse. Nothing. That is a one negative. One negative. Incapable is the second negative. Double negative form. So this is how a report is given in case of examination of accused of rape, especially potency certificate. So this completes your two important exercises. One is basically examination of accused of rape, examination of victim of rape. So any doubt in this, guys? If you have any doubt, you can ask me for next. You can ask me last 5 minutes, guys. Any doubts? Any doubt? Veda Supava, Bhumika, Srimati Shokumar. Notes, I think in Telegram. I'll let you know after the class, Bhumika. For physical examination, accused or victim, 12 years. 12 years. 112, Bara. Srimati Shokumar, it is 12. 12 years. Veda Supava, any doubt? Veda Supava, any doubt? Rakesh, Bhumika, Vinu Upadhyay, Jahir Ahmad, where are you, Jahir Ahmad? Come on, guys.